Hello everyone. Today we will be talking about chlamydia treatment. Let's get into it. Like I've said before with these small OB-GYN presentations, just focus on the bugs and the drugs for my exam. It's kind of fun saying that. So just focus on the first line treatments. Let's get into it. Quick presentation. So Chlamydia trachomatis is a small gram-negative bacteria. Most common cause of STIs in both men and women. In the US specifically, it's the most commonly reported nationally notifiable disease. What does that mean? It's famous, nationally notifiable. It's like the Kardashians, right? Famous. Significant proportion of patients are asymptomatic, so therefore you have this reservoir for infection, which I don't like. I mean, that sounds, I don't know. That's the way it is. It just sounds gross. But yeah, reservoir for infection, so it's out there. So please, another reason. I try not to get on my soapbox, but another reason, please practice safe sex. Most frequent clinical manifestations include urethritis for men and cervicitis for women. So what does that mean? Pain, discomfort. Like I said, this is going to be covered in more detail in your OB-GYN ICM. Goals of treatment. Definitely decrease the risk of transmission to others, resolve the symptoms, and prevent complications. So the complete care should include antibiotics, which we're going to be talking about, and some HIV testing potentially, and definitely counseling on the patient, and definitely you need to be thinking about the person's sexual partners if you can. So there are some antimicrobials, antibiotics. We have a tetracycline, doxycycline, and a macrolide, azithromycin, that are both very good at killing this bug. So those are going to be your first line antibiotics. And this is specifically for uncomplicated chlamydia. So azithromycin or doxycycline. The azithromycin, one of the advantages of it is given a gram single one-time dose. So 1,000 milligrams equals 1 gram, so a gram single dose. And I don't think I mentioned this to you guys before, but when I worked at the Chickasaws, we actually had, they make a powder form of this azithromycin 1 gram. So it looks like Fun Dip. I don't know if you guys seen that candy before. Okay, I thought this is what it looks like, basically. 1 gram little packet. This is what Fun Dip looks like, but don't worry about Fun Dip. It's not on the exam. But to me, it just reminds me of Fun Dip, little packets of powdered candy. But so this is what it looks like. You give a 1, and this is where we mix it up in front of the patient, in front of me, and they would have to drink it in front of me, and I have to document that, yes, they indeed took this medication. So that has nothing to do with anything. No, that's just, FYI, don't worry about that. That won't be on the exam. If they, for some reason, can't take the macrolide, they can't take the azithromycin, they're allergic, etc., you can go with doxycycline. This one is going to be 100 milligrams BID times 7 days. Both are good, but definitely with the doxycycline, you need to make sure that compliance is maintained, or rather that the person adheres to the medication, they take it all. And then when a woman is pregnant, they should not be taking doxycycline. And if you suspect pregnancy or whatever, definitely do a pregnancy testing to rule that out, because doxycycline, the tetracyclines, are not recommended in pregnant women. So that'd be a reason why to not prescribe it. Therefore, you'd go with the azithromycin. The chlamydia can occur with a gonorrhea infection, so they can happen at the same time. So that's why you typically will do kind of a dual therapy, dual treatment, which we talked about in our other presentation. Empiric therapy for chlamydia infection should be offered to a person who presents with symptoms, especially true if you don't have a proper test. So yeah, it's basically like if you're pretty sure, go ahead and treat the patient. If you're going to do empiric regimen, and you're interested in both chlamydia and gonorrhea, you can do the ceftriaxone plus doxycycline or the ceftriaxone plus azithromycin. So please refer to the other lecture where I talked about that. And then again, with doxycycline, it's going to be 100 milligrams BID. Ceftriaxone is 1 IM shot, 250 milligrams. And then men with epididymis, empiric treatment for chlamydia and gonorrhea, again, ceftriaxone plus doxycycline, or the azithromycin. Doxycycline, again, 100 milligrams BID for 10 days. Ceftriaxone, 1 time IM, 250 milligrams. A test for a cure for assessing the adequacy of prescribed antibiotic is not routinely done, except for pregnant female or people who have quote-unquote persistent symptoms, and that can be done at 3 weeks after treatment is completed. Recently infected person should have repeat testing for chlamydia approximately 3 to 6 months after treatment, regardless of the patient believes their sex partners were treated. You need to rule out reinfection. This is all FY, by the way. And that is it for me. So thank you guys for your time and attention. As always, focus on them bugs and them drugs for my exam. I don't know why I got all country there for a second. Getting them bugs and them drugs. We're from Oklahoma, people. We country. Okay, sorry. My Oklahoma roots are coming out here at the end of this presentation, I think, because I'm getting kind of tired. Thank you guys for your time and attention. I already said that. And please, as always, email me any questions, comments, or feedback. Talk to you guys later.